Hello everyone, welcome to today's webinar. This is Mike Steckline, partner for Institute for Enterprise Excellence. I see we have a couple of attendees that are dialed in today. Appreciate your time today. I don't know where you're at in the country, but the photo on the slide sort of depicts what I've been up to. Today's not as bad as it was, but we've been dealing with Minnesota, as a number of you have, I suppose. This is also a day that we remember, a day in history, and the students around the country are observing this. Columbine High School. Interesting, that photo that I've shared here on the screen actually comes from my brother Dale, who lived in Colorado and shared that with me. And so hopefully people are taking some time to reflect on that, and an important date in our country's history. Little housekeeping details. Normally I would have the phones muted, but I've left them unmuted today so that people can interact and bring up questions as we proceed. If there's some background noise, I'll go through and remove the the conflicting noise, but otherwise I'll keep the phones unmuted. Feel free to chime in as you wish. You can also use the chat function to raise a question if you want to bring up a topic or ask a question. And this webinar will be recorded for your use later on, as well as any others. So the purpose of today's webinar is similar to one that I did last month, where I gathered together some of the key presentations that we covered in 2017 and went through some of the key topics and reviewed those. It's similar to reviewing a good book. Read it more than once, you learn some more deeper things, and also many times there's deeper learnings after the presentation as people continue to apply the concepts. So the topics we talked about last time are shown on this slide. Each of those bit.ly links below takes you to a recording of that presentation, and this large bit.ly link at the top will take you to a recording from last month's entire webinar where we talked about those things. This month, these are the topics we're going to try to get through, and if we've got the time, we're going to cover each of the topics. My purpose today is not to rehash all of the details of each presentation, but try to represent the key topics that the presenters provided. If some of the presenters from those topics are on today's webinar, when we get to those topics, if they've got any additional items or clarification, I would like for them to bring those topics up and have everyone benefit from that. So the first presentation summary that's on here is, in June, Mike Grogan gave a great presentation. At the time, he was unveiling a book that he was writing, and it was available in electronic format, and he shared a free copy with people who participated in the webinar. But it was on the topic of unlocking the habit code. So the webinar recording link you can see there, and I'm just going to go through some of the key topics that Mike talked about. So this slide shows you some of the key things that he was going to present, and also that link below will take you to that recording of the webinar that he provided back in June. So these slides are combinations of a number of his slides, and some of the things that he presented when it comes to habits. He pointed out that we may be highly inspired and really want to exhibit new habits, but being inspired, high ambition is not going to be enough. And just knowing what we need to do and even know how we need to do it is not going to be enough. And he nicely summarized what he saw as the change problem, similar to why most of the New Year's resolutions don't take place, and why many of the company initiatives, whether it's a continuous improvement initiative or any sort of initiative like that, really doesn't make a lasting impact. And he broke it down into a couple of problems. One reason had to do with the way we tend to teach, and we tend to keep making the same mistakes, including teaching how people can change their habits. And he highlighted three topics of interest in the book. One is what he calls a new perspective on habit creation. The book that he features focuses on telling stories, and there's a number of characters, and he drew those pictures at the bottom. So 7 stories are included in this because he realizes the importance of a narrative to explain the concepts. And then he talked about this 21-day challenge, which I think is different than, there is a book called 21 Days to Make a Habit. We know that it's more complex than that, but he does outline what he calls a 21-day challenge. And in the stories that he provides, he shows how different people are trying to practice new habits by dedicating to this 21-day challenge. Another helpful concept that Mike introduced is got an acronym which happens to be the same as the last name of a famous soccer player. And the MESSY acronym stands for trying to make your process meaningful, easy, social, setback ready, and incentives. And again, I'm not going to go through all of the topics that Mike talked about back in June, but if you are interested in trying to either develop new habits for yourself, which is a lot of what this cultural transformation work is about, trying to identify and practice new habits, or if you're trying to help other people to practice new habits, whether it's leader standard work, problem solving, whatever it may be. I find high utility in this model that Mike presents here, and it's a handy acronym to keep in mind. So I would encourage you, if you find this to be useful or interesting, go back to the actual recording, and I'll show that link again later. And again, this is going to be available on a recording that you can go back to and learn a little bit more about this handy acronym that Mike provides. In this slide, Mike summarized that by focusing on the right habits at the right time and using the right approach, we can make both the personal changes as well as those that relate to business and life change. So this was an all-encompassing sort of a presentation that Mike was talking about, habits relating to business, but also habits relating to personal life. So a summary slide here from Mike's presentation. The URL, there's his contact information there if you want to contact him. I don't know if Mike's on the webinar today. He's maybe asleep right now. He lives in the Philippines. There's a video from the presentation from June, but also if you want to go to that link, you can learn more about getting a copy of Mike's book. So I'm going to pause and see if anyone has any questions. I'm also interested if anyone tried any of the concepts that Mike talked about back in June. So I'm just going to take a brief pause here and allow people to weigh in if they wish to. If you go to the presentation, Mike also talked about an app that you can get for your iPhone or your mobile phone and use. And I'm trying that. I found it to be very useful. And you can go to the webinar recording from last time's webinar and take a look at it. I have found sharing this model with people to be very useful, because many times what we're really talking about in an organization and a cultural transformation really does come down to how do you help people to start practicing new habits. So I find high utility and usefulness to this presentation. So I'm going to go on to the next presentation that we shared, and this is back in May of 2017. Now we've had a couple presentations on this white paper that we're still trying to write, the topic, the Pracademics Guide to Strategy Deployment, and it can be a pretty big topic. So we've done a number of these webinars on this particular topic, and we've got another one coming up in the next couple months to build on these concepts. So I'm just going to retrace some of the key things that we talked about in our first webinar. So there's a number of mental models that are starting to show up in the actual white paper, and so we've listed 10. I think we may even be on to an 11th. There's nothing magic about the number 10. That would be handy to have, but you can think of this as sort of key concepts that we're learning about and trying to help others learn about. In the first webinar, we covered those with the check marks there. So the purpose of today's presentation is just going to retrace some of those concepts related to strategy deployment. So one of the first topics just sort of backs up and says, what is it that we're trying to accomplish? How does a strategy deployment system help to support what you're trying to do? And one of the key topics that we're putting in our white paper has to do with what we're really after is trying to change the style of management, the mental models of management, from the prevailing style to quite a different style, one that's based on understanding systems, looking much more at focus on the individuals. So some pretty profound differences. And we think that's an important concept to keep in mind with when we're thinking about strategy deployment and how does it support overall what we're trying to do. Now, relative to this concept, and we talk about this in the coursework that we offer, we talk about systems. So we know strategy deployment as a system. And we think about there's other kinds of systems. And one kind of system shown in the middle there are the work systems. Whether it's the work to support an external customer or an internal customer, we just think about that work system, whatever the work that is you're trying to do. That's the only system of those that are listed here that are actually going to provide value to a customer, value-added work. And then we think about systems that help to align the work systems, systems that help to enable the people, and then systems that actually help to improve the work processes. And I just drew an arrow there to show that relative to this, we think of strategy deployment is one of the systems that helps to align. There could be others, but it seems to be a pretty key system that helps to align those aspects and aligning the work that everyone is working towards some common objectives. Now, we also talked about what strategy deployment isn't, and we found this to be very useful in conversations. Some of these quotes come from Dr. Deming, Peter Drucker, and we've just been pretty straightforward as trying to be clear that strategy deployment, as people have been developing and using it over the years, can easily fall into these categories if you're not careful. It can become merely management by results through fancy methods or new tools, but it is still management by results or management by imposition of results. And we think that's an important distinction that people need to know about. Now, in our conversation last time, when we talked about these things, there were some interesting questions. These show up in the recording from the last time that we did this in May. And we had some good discussion about, well, if it's not management by results and not management by imposition results, how do we think about the big, hairy, audacious goals or the BHAGs or stretch goals? How do we keep that in mind, or how do we think about that? Because it's a concept that a lot of people are including in their work. And also some good conversation about how do we better focus on the critical few. One of the people on the presentation talked about their vision of Destination 2020. How do you create a better environment to do that? So we had some good conversation last time on the recording about these concepts. And again, it wasn't for the purposes of getting answers to those, but we think those are important questions to keep in mind as people are trying to develop better strategy deployment systems. Now, the third key concept that we wanted to convey in the white paper has to do with this hierarchy model that is familiar to most people. You ask people where they work in an organization, and many times they'll draw a diagram like this, and they'll show you where they are, and that tells you things, and it can be very useful. But the point we wanted to make here is, and the problem isn't the hierarchy structure, it's how it's oriented, and the need to move from thinking about this as a command and control sort of a focus to really an alignment and coaching focus. So it doesn't mean that you need to change necessarily the org chart, but if you tilt your head sideways and look at it that way, you can think about what is the work of people at various levels of the organization, and how are they all working together to try to accomplish the goals of the organization. Now, with this as a foundation, we then started to draw some new diagrams about some of the key systems, including strategy deployment, but also managing for daily improvement and standard work as it relates to these key topics. And so this is something that shows up in some of our work, most recently in a white paper that I've got a slide that shows something a little bit later. And how we're trying to help people to move from the time that they're spending. So the purpose of this slide is to show in the ideal world, where would leaders be spending most of their time? Where would managers be spending their time? Where would frontline be spending their time? And that red line in the corner down here at the bottom is just to depict that in most organizations, leaders would like to spend more time thinking about strategy and working on developing strategies to prepare the organization for the future. But they find themselves getting involved in the daily problem solving, the daily firefighting. And the same thing occurs to managers, and the front line we see are not as active involved as they could be in having systems that help them to improve their work. And so the idea is to try to help move this line up to more of a balanced approach. And you can see if that occurs, what are some of the key activities that people in the different roles would be doing as they move to this. Now, we also know this is going to take time, so it's not something that's going to occur quickly. But it's been a useful model to help people to think about this. Now, one of the changes that we made, and this was highlighted in the webinar presentation, if you go to the recording, is we flipped the direction of the triangles this way for purposes of showing a little bit more about the role of the daily management system as a kind of wedge to put into the organization to try to maintain the gains that are made in improvement efforts, whether it's through Kaizen events or improvement work. But that was one of the reasons why we flip-flopped that and to show the orientation that way. The last time we had a conversation about this, we had some good discussion about the role of leaders and their view on how to meet the needs of the customers. And we talked about different ways to represent this. And it's true, leaders are trying to think about the customers, both the customers they have now and the customers of the future. And there's different ways that we could think about organizing that. We also had some good conversation when we had our last conversation about what's going to be needed in order to move that line more to a balanced approach. And one of the key things that people talked about in the webinar has to do with helping the front line to be more proactive and helping them take more of an active role in the improvement work. And then some really good discussion about how much time do leaders and managers actually spend in the Gemba to understand what's going on and to spend their time coaching. And I think some of that can be addressed as people are working more on what is the standard work, call it the personal management system that leaders and managers are working on. So I mentioned a white paper where some of these concepts are discussed. It's shown here on that bit.ly link, so if you want to learn a little bit more about that, we called it side-by-side management. You can get into some more details around that. And another one of the key concepts that we're trying to convey in this white paper has to do with fundamentally different principles of management are needed. Now, people may think that this is fairly evident, but it's not too uncommon for people to look at the tools that they'll see, and for instance, they'll notice that another organization uses an X matrix, or that they have an Obeya room, or that they have no meeting time, or things like that. And what they're doing, what the tendency can be, is to just copy the elements that people are doing on the surface, but they're not thinking deeper about what's underneath it. And we just depict it this way with the iceberg diagram to help people to remember that this really does have to do with understanding new principles, and merely trying to plop on strategy deployment tools on the existing prevailing style of management in our way of thinking isn't going to work. One of the other topics, unpackaging this a little bit more, just talks a little bit about, so what are some of the key concepts that are different from the, call it the prevailing, and starting to think about not just the prevailing, but the failing style of management. And what do I mean by that? There's a key point that's illustrated in another one of our white papers, and it has to do with thinking about these S-curves. And you think about the different ways human beings have been organized over the years, and you go back to, say, the agricultural model. At a point in time, the agricultural model was the predominant model of organizing social systems, social groups, but over time it couldn't solve problems that were coming up, and they had to jump to a new model. And the new model, or the new S-curve, was the industrial model of the world. You could solve new problems that couldn't be solved by working harder at the agricultural model, by using the industrial model, the machine view of the world. And where we find ourselves now is realizing that the industrial view of the model of the world cannot solve the problems that we're dealing with, and we need to move to a new model, a new mindsets of management. Call them systems thinking or network thinking, but many of those are listed on the topics on the right hand side of this column. So I just insert that as a reinforcement of some of the things that we've talked about. When we had the conversation last time during the webinar, people talked about the importance of having an equal emphasis on lateral learning, going beyond a focus on results, but describing how important it is to see learning as important. And you need emphasis and systems that reinforce this as well. One of the key differences, and it's probably a topic to add to the columns here, has to do with, under the prevailing style of management, the professional bureaucracy, how people can settle in on that, and the different rules for the future is optimizing for the future. Now, I'm currently reading a book that people might find interesting here, talking about networks and bureaucracies, and it's a great book by Neil Ferguson, titled The Tower and the Square. So I've inserted it in this webinar as a reminder there. Another topic we talk about here is too much on our plate, and what happens when we recognize that maybe we're trying to do too much, or just adding more initiatives is not really going to solve the problem. And we had some good discussion last time. We talked about what needs to happen to change the systems and tools in order to better focus and help involve people to get going on these topics, and to undo or take things off the plate that perhaps don't need to be there. So that was a quick high-level summary of some of the topics around the first part of strategy deployment, the Pracademic's Guide to Strategy Deployment. And again, I'm going to pause and see if there's any input from any of the participants. Curious to see if people have been using these concepts, this model, in any way in their work.
Hello, Mike. This is Dirk. Can you hear me?
Hi, Dirk.
Good afternoon. I've got a quick question. So if you go back to the previous slide, can you just recap on what one would propose to do and how to go about 5S'ing the plate and doing the deselecting and then selecting the few that actually are meaningful to the business, depending on which different types of projects you want to take on to move the business in the direction it needs to go?
Yeah, that's a great question. And when we did do the second offering of the Pracademic's Guide to Strategy Deployment on this, we did get into that in a little bit more detail. And in the actual white paper that's forming up, there's some suggestions on some processes that can help people to filter and prioritize how they're spending their time and their work. I know that a number of people that were on that webinar talked about the things that they were doing. So there are some suggested approaches that we did talk about that, but also in the next version of the white paper, we got some more details. What I can do is I can send anyone on the webinar today the draft of the current paper that has some of those suggested processes in them, and you could then offer feedback or tell me more about how you would like to learn more about that. How does that sound?
Sounds good. Thank you.
Great. Any other input on this particular webinar on the Pracademic's Guide to Strategy Deployment? Okay, it's an important topic. I know a lot of people are trying to get their heads and hands around what this strategy deployment is all about and how it fits into the organization. So as I said, we got an upcoming webinar. We're going to be talking more about the more complete picture, but I will send out the current draft of the white paper to those that are on the call and see what input people might have on that. Another webinar that we had last year, great webinar by a friend and partner in this work, Dr. Sammy Bari, the first lead dentist, lives in Jacksonville, Florida. Gave a great presentation, got a lot out of it, and I think other people told me that they got a lot out of it. I'm just going to share some of the key concepts that he shared at that time. So he talked about how he and his team proceeded in learning about this work, and it's a very interesting story. One of his first books, and I'll just show you back here. That picture of that book's not there, but the Lean Enterprise Institute wrote a book with him called Follow the Learner. And the one thing that you learn about from talking with Dr. Bari, Sammy, is that he really digs into the theory and the principles behind this and then thinks deeply about how does it work for his work. And I'm going to illustrate some of those things in his presentation here. So he was talking about in the dental practice, how's he going to reduce the lead time, the time that it takes in order to process the work and try to remove the waste. And so he did talk about how he went back to Taiichi Ohno's work and talked about, so how did he do it? And in the course of his presentation, and I'm not going to recap all of them here, but it's a really great example of, on the left-hand side, here's what he was trying to do. Here's his countermeasure. And then what did he experience? And then what did that mean as far as continued learning? So he went back and forth on these concepts to try to help to understand not just how do I understand the theory, but how do I apply it in tackling real life problems. So one of the first things that he and his team addressed is trying to create one-piece flow in the dental practice. And this is what he was after. He was trying to think about how does he think about the patient, and say the patient's in a chair, and having the caregivers come to that patient and do what they needed to do, and then have that stay time and lead time equal the same time. And that was one of the things that he was trying to do there. And so some of the things that he did was he thought about the work that Taiichi Ohno and others had done in the SMED process, or the single minute of exchange of knives, and thinking about how could he improve setup time between patients. And what he was really trying to do, you think about the patients on the top here, illustrated by A, B, C, and D, that S that he was trying to tackle was the setup time, and how do you reduce that setup time needed between patients in order to help make things flow, which was really interesting and great work. And the next topic that he realized he needed to address was leveling the workload. So what this meant, he went back and learned more about the principles about what other people were doing. He learned about calculating tack time and trying to do some level loading of some of the key procedures. So he gave us some examples of some calculations he did on the cleaning process and how he calculated tack time, and then how he applied that in different experiments to think about how's he going to make that work and better level loading the work. So a great illustration, and I encourage you to go back to his original recording because he really does a nice job explaining this. I think anybody in healthcare, and any industry really, but that is trying to think about flow could demonstrate or could benefit greatly from Sammy's webinar that he provided. So he was thinking about how do you work across the functional barriers, because the hygienist thought about their chairs and the dentist thought about their chairs where the patients sit. And they had to really understand that it's better to think about it's the patient's chair, it's not our chair, and how do we think about that and remove some of those functional barriers. Then he talked about a new problem they came up, which was how do you synchronize the tasks? How do you help this to be coordinated? So again, he went back to the principles and theories, and he learned a little bit more about what was needed, and he experimented with this idea of a patient care flow manager. And the person who was freed up from some other responsibilities to really try to help to coordinate who's doing what when. And one of the things they learned was it had to be more than just designating a person. They had to come up with a process. And within that, they experimented with a tool that supported them in the process so that people could see how did different patients need to be queued up and who's doing what, and how do you coordinate this way, really orchestrate it in a nice way to help to make things done. Sammy did a nice job showing all of the great results that he's achieved in applying this process. And again, I encourage people to go back to his presentation. Now, one of the interesting things that he introduced, and I found this of great benefit, a lot of people talk about identifying and removing waste, but Sammy took it from a different perspective, which I think is really important. So he got underneath the surface. And again, he referred to some great resources here. And he talked about in any sort of a business, we sort of inherit excessive resources. We have available time, we have available space, we have available people, we have available equipment, things that we think we need to use. And what does that mean? Well, we tend to overproduce. We make things too soon, we do them too fast, we create too much. And then we have excessive inventory. Could be actual supplies, could be inventory of knowledge, it could be things that are in the queue that may or may not need to be done. And then from that come the 7 wastes. So what's interesting here is many people, when they learn about this, they start learning about the waste of motion and the waste of waiting and the waste of defects, which is all well and good. But Sammy's one of the first people I saw that really unpackaged it and talked about, so why do those things occur? How do they occur? And I thought that was a very important concept that Sammy brought to the conversation. So again, I would encourage you to take some more time and go back to Sammy's webinar. The recording is there on that link and is available for others. So again, I'm going to pause and see if anyone had some questions about that, if anybody's been experimenting with trying to create better flow in their work systems and their work processes. So I'm going to pause. Okay, great. Now, another webinar we did back in March, Debbie McAllister gave a great presentation. And Debbie, I think you're on the call today, right? Is that true? I see Debbie's name. Maybe she's on mute. There's Debbie.
I'm here.
Very great. Okay, good to hear your voice. So Debbie, I'm going to do my best to highlight things here, but I would like for you to add any commentary here as we go through this, because you had some really useful material to share, and I wanted to make sure I get it right.
Great,
so
thanks.
You talked about this building the coaching partnership and how you saw it as 3 interacting circles, right?
Yes.
Okay. Great. And then one of the other concepts you talked about, and I know that there was another slide that shows what happens when the trust level is low, how that decreases the speed and increases the cost. So I thought this was a really important concept. Do you want to say any more about this particular slide? Because I thought it was really cool.
I think that the big takeaway on when we increase the trust with the decisions is that it brings together teams together faster. So instead of going to, say, a team dynamic where you're going around and around and trying to make a decision,
right?
They've actually shown the research that it has teams come together faster.
Yeah.
And so you're able to quickly come through, and the questions themselves change from being focused on more about just working out some of the technicalities of it versus questioning each other on what we're trying to come to consensus on.
Yeah.
Or solve the problem.
That's great. Now, another one of the topics you talked about was you identified these 13 behaviors that seem to be particularly important around building trust. And then you've also highlighted a really good resource that I find useful, and I know other people perhaps have, talking about Patrick Lencioni's work on the 5 dysfunctions of a team and the importance of building trust at that baseline.
Yeah, he's really, this is one of my go-to books when you start working with groups, and we, as we come in as experts trying to help them problem solve, what we continually see is this absence of trust in the foundational part. And so it makes our job a lot harder in trying to show them how to use our tools or change the behavior without the trust. So I continually go to this about where we have to build that foundation and using those 13 characteristics, simply by listening and the respect for people that we talk about. But, and um, for me, I see these as a lot of integrity type of behaviors, the characteristics, but listening to understand versus to tell.
Right. That's great. And then you talked about the coaching partnership, and you offered some really good advice, but also some excellent resources that we've made available for other people that would like to do this. I'm just showing those slides quickly, but you got some really good advice on where do you focus your time, how you think about them as trying to meet their needs and going to where they're at, and you're making good on the commitments that you make. So I thought this was really helpful advice.
Mm-hmm. Yeah, I think my biggest takeaway on humility and how it shows up on an everyday basis is when you're in that that one-on-one situation, is that you're not thinking about what your next question is. I know a lot of times as a coach, we're trying to get the right questions to get the right thoughts, and really focusing more on what's being said versus trying to think about what we're going to say next.
Right.
Because it could change, and I think it really shows a lot of humility in being able to do that, and then to meet them where they are every day that you coach with them, and being very, very present and mindful. And I know a lot of coaches talk about being mindful, but these days, but it's really important to listen.
Yeah.
And meet them where they are. They could be having a rough day.
Yeah. Right. Right. We all can.
Mm-hmm.
And then you identified some key tools that you use, this coaching partnership and a vulnerability exercise. And we did make it available last time, and I've got a bit.ly link to share later if people want to make these available to themselves. Have you had any follow-up conversations with anyone about the usefulness of these partnerships or this vulnerability exercise?
I had a few people reach out and try them and ask a couple of questions about it. I think more for clarity. And some of them found it, it was useful for them. And it was a different approach than what they had tried before. In trying to, I think they were trying to more on reestablishing relationships where they had already been coaching, and they wanted to reset where they were because it wasn't making the progress that they had hoped. So they thought they'd try a different, let's go back and try something new. And this was their experiment.
That's great. So I got those URLs later on in the slide presentation. And I thought this was an interesting slide, and especially the picture on the right-hand side where you talked about it's important to have big ears, big eyes, and small mouth. I heard that exact advice from Ritsuo Shingo, son of Shigeo Shingo, and some of his advice as far as what do you need to be doing as a leader when you go to Gemba and you're trying to understand what's going on.
Yeah, I received this from one of my coaches early on, and that constantly, it's not about me.
Right.
Which I think a lot of us, as we coach others, sometimes we make it about us. And so really active listening really is a skill that has to be practiced.
Exactly. And then you had a nice definition of what does it mean for vulnerability, and you've got this nice grid talking about how you think about that around that grid. Did you want to say any more about that?
I think so. This was something that I was shown by one of my mentors on how we go through the whole our whole emotional process, our own behaviors of the people that we are coaching. But I really see the vulnerability as when I show up at myself. I'm not trying to be Mike. I'm not trying to be, some of my mentors. I'm showing up on how I am and how I hold that space as myself. And I've been asked recently too, what does holding the space mean? And it really is just being present, being respectful, listening, and putting my attention on the individual that I'm working with is how I define holding the space. And so me trying to pretend to be you would not serve myself or my client that I'm coaching.
Right. And then you had these 10 physics of vulnerability that I thought were great. I combined them into one slide here. about what's going on with vulnerability, and also this notion of practicing before you're ready. I thought that was very helpful. And then you got some important advice here on, so why is it important to be vulnerable, and showing our own vulnerability, human to human, as we're trying to help people to make this improvement.
Mm-hmm. Yeah, sometimes, we have a tendency to want to pretend that we're perfect,
Mm-hmm.
and that doesn't build the trust. People see through that. They can feel when we're being genuine,
Right.
being ourselves. And so I really encourage people to show up as who they are, with their strengths and our weaknesses.
Yeah.
It could work very well for the client that you're working with, and they see that we're meeting them where they are, and so they're allowed to be vulnerable and going through change that really makes a big difference.
Right. And then you had some nice tips here as far as what do you need to do to be prepared, letting people share, and this whole idea of emotions that come up, and how do you um, honor those emotions and not avoid them, and either in yourself or whoever you're coaching. I thought that was great advice.
Mm-hmm. Yeah, I'm a big fan of Renee Brown,
Mm-hmm.
Vulnerability expert out there, and they are going to come up. Emotions will come up, and they're going to come up differently for everybody. They could be frustration. They could come up with. I've had lots of people cry in coaching,
Mm-hmm.
in manufacturing and high tech and in healthcare, and so just not trying to stop it. Sometimes that's the best way for people to figure out, where they are on their own change process, and accepting different behaviors.
Right. Right.
So
That's great. So Debbie's done a great job of putting some good advice out there. To listen to the full recording, you can go to that Bitly link, and then the link at the bottom on those advising practice documents. Just people can get those there. So appreciate that. And glad you could be on today's call to help to make sure that I got that correct. So I appreciate that, Debbie.
yeah. Well, thank you, Mike. It's my honor.
Sure.
Thanks.
Another presentation that we featured last year has to do with some work that's going on in Decorah, Iowa, at a critical access hospital, Winneshiek Medical Center. And so they talked about their daily management system. A lot of it is around communication, and the recording to their presentation is shown there. And they started their presentation talking about sort of the typical story about a problem that occurred, had to do with something in the ER, some questions that occurred, and then they listed out, so what's the typical way that we used to do this, and most organizations might tend to do this, and they described through best efforts somebody putting something, a note down, and trying to remember to bring it up at a future meeting. Meeting gets postponed. Some issues occur. Time gets delayed. The meeting is canceled, and the end result, things still aren't answered. Things still aren't addressed, and people get frustrated, and they wonder, "Gee, does anybody care about us? Does anybody know about this? Who's handling this process?" And so there can be a lot of delays and a lot of confusion, a lot of frustration. And so this team talked about trying to address problems like that, and how they try to address it through a daily series of communication huddles. And many people on the call and those that listen to the recording might have such communication huddles that they are using. And these folks do a nice job of explaining not only what they do, but why they did it. And this slide shows that one of the reasons why they got into this was more than just those daily problems that weren't addressed quickly or sufficiently, but many of their measures, their key performance indicators, were trending in a way that they didn't wish them to be. And they also had what many people say is, well, we did lean, or we're doing lean, but there didn't seem to be something that was taking hold, or wasn't really tackling the key results. So they needed to do something different. So they designed a system that includes a number of these different huddles, and I've summarized a number of their slides on one slide to show that there are different levels of what their huddle system, how it's designed to work. around communication, also some problem solving, but also try to help facilitate this so that by 9:30 on any day, any of the issues that came up in the morning or that came up last night or the previous day, people are aware of those and they know who's working on what, and they really do a nice job. They also talked about the tools that they use, and you can borrow a tool from someone else, and they were willing to share their tools, but they also emphasized the need to design a tool that's going to help you and to inform you. And they talked a lot about some of the benefits of doing things this way, how it actually resulted in fewer meetings, and the changes that they saw in staff engagement, and also how leaders were more approachable from the frontline staff. And then they did a nice job explaining, so what was needed in order to help this make sense. It had to be more than saying, okay, from now on, here's what we're going to do. It took some time for them to develop this and practice it and show it was something that was going to be sustained, that wasn't just going to die out over time. They also did a nice job explaining an idea that they saw from another organization. And I've heard a lot of people talk about this, that you need to declare a no meeting zone. And what they learned was that although the idea makes sense, a time when people are not going to meetings, but they're actually in the Gemba actually making improvement, what they realize, and this is a learning that I've heard from other organizations, it's more important to think about, it's not no meeting, it's more about devoted time to go to the Gemba to really understand what's going on. So they did a nice job summarizing some of the key things that are required in order to make a system like this work. And they got into a little bit about leadership standard work and how they're experimenting with leader standard work, what the personal management systems are of the leaders that are involved, whether it's executives, managers, supervisors, and also this notion of creating pull versus push. And it's, again, easy to tell people what they need to do, but it's more beneficial if you can create a culture of pull where people are going to want to do this. They'll see the benefit of doing this to make their work easier. They gave a nice example with one of the departments, and this is a department that's also done a webinar for us in the past, the rehab department, and how they have benefited from doing this kind of work in the tiered huddle process, but also how they're building it into their daily management system. And also how that's addressed not just those measures that we show on this slide, but how it has helped with some of the other, call it more balanced measures, whether it's expenses, growth, customer experience, and so on and so forth. So they got into that nicely. And then they had the opportunity to apply what they learned using a sort of a team Kanban approach when they had to respond to a Joint Commission survey, and how they could quickly visually see who's working on what's the progress, and how can they make progress. They gave some great advice for any organization that wanted to try this as well. Resources, ways to get started. And then they also real forthright to share some of the things that they had learned, lessons that they had learned and they continued to learn. And they're always trying to continue to build on this to this day. So again, you can learn more about their presentation on this by going to that link. Is there anybody from Winneshiek Medical Center on today's webinar that would like to share any perspective or updates on the work that people are doing? I'm going to pause a little bit. Okay, no presenters today. I want to go to, what I'm going to do, I see Dirk is on the presentation today. I'm going to skip over this presentation, and I want to make sure that I'll cover that presentation a little bit later. But Dirk gave a nice presentation on some of the systems thinking that he was doing. Dirk, are you up for this to weigh in on this as I go through this?
Yes, sure, I'm ready. Go ahead.
Okay, great. I'll make that slight adjustment. I'll cover the other presentation that I skipped over during the next summary webinar, but Dirk gave 2 webinars actually on systems thinking, and this was version number 2. So he had done an initial presentation and talked about some things. He talked about some of these concepts that are here. His webinar recording does a nice job of understanding the experiments that you were trying to do. You want to say more about what your initial current experiments were at the time, Dirk?
Right. So at the time, what we were trying to do is understand how we can apply this concept of systems thinking in some sort of practical setting. And at the same time, we were trying to work with our senior leadership team to get them to adopt principles and behaviors. So we wove it all together to try to get them to build a little system to go Gemba walking. So that was our experiment. It had some success, but also some limitations. Because one of the things you need to bear in mind with change management, of course, is, and behavior change, is that systemic change like this requires personal change, and then the personal change requires motivation, ability, and triggers, and you need to understand whether the motivation truly is there. So that ties back to some of the other presentations that are in today's package as well. In the background, you've got to bear that in mind, because otherwise it doesn't work. Right.
And you talked about some of the other experiments that you were out and about at that time.
Right, yeah. So the one for the audit running for the infection prevention team has worked really well. So that's been very effective. They have a more productive running experience because of it, get better results of it, get better interactions because of it, and stay on top of it more. The respiratory team as well has improved the way they manage what they do with their consult service, and that is a system in itself as well, and they've just revamped that entirely recently as well. We didn't use systems thinking as such as a major component of discussion in that, but that's really what's in the background of that. And then the other thing that's currently going on is on one of our model cells, we've had a number of activities now over the past year that has changed the way the nursing staff works together. It's a general med surg floor, so that they now have developed a buddy system. So the nurses work in pairs and do certain tasks in pairs, such as happy prevention, turning the patients, lifting help on arrival, etc., etc. And what's a natural development out of that now is to build a daily management system around that for the manager and the charge nurses to stay on top of the standard work that's been implemented in order to keep it consistent and to sustain it going forward, and of course then follow up with continuous improvement after that.
Yeah.
And that is kicking off in the next week. We are doing a workshop on that.
That's great. And you also had some interesting slides here. One had to do with thinking about teams and understanding teams as a system, but you also brought in some concepts around the application of simple rules and complex adaptive systems. So I would encourage people to go to your recording because you had some really good advice and perspective on that. You talked about the understanding the difference between really it's the gap is the difference is the performance, not between performance and the structure. It's the gap in our expectations in the structure.
Yeah.
And you introduced some concept from a great book, Daniel Kahneman, Thinking Fast and Slow, and how that comes to bear with this. And you got the inclusion of some great advice from Dr. Ed Chaplin, who gave a great presentation, and I've got a URL link to his presentation. But I also like how you picked up on what Ed had talked about there as far as thinking about these as apps, you know, the shortcuts to how we make these thinking changes. Did you want to say any more about that?
I think the key thing here is that we're often not aware that we are functioning this way. And it takes a workshop to kind of tease that out and to break out of the mode that you're in and actually think about something. And that's one of the reasons why when we have a Kaizen event or a rapid improvement event of 4 days, actually I recommend people bring Advil because they'll have a headache by the third day.
Yeah. I'm going to jump to one of the other slides here because I think it was an important concept that I remember from your presentation. And it's not uncommon for us to say, well, people need to unlearn what they need to know. But then you talked about, well, probably need to think more about those better patterns and those better apps as opposed to thinking about unlearning. I'm not saying one is right and wrong, but I thought that was an interesting concept.
Yeah.
And then you shared some of the things that were working, things that you were trying to do. You had some good advice for other people that were trying to help people to think about systems thinking. I think you had some good reflection on it's easy to go too deep with us. That with this it can get real theoretical as far as thinking about systems. And also your advice on using hands-on work and simulations to help people. Do you want to say any more about that?
Yeah, no, just a simple exercise, for instance, when you've got a group together that systems of the huddle exercise, there's a video about that where you get people to stand in a group with in threes with 2 feet apart, and then you insert a change somewhere. So now they have to reshuffle to get their arrangement redone, just to show the whole stone in the puddle kind of ripple effect that something like that has, and that you often cannot understand on the face of it what the cause is of a particular effect that you're seeing, that it's usually not linear.
Yeah. So you mentioned some current work that you're doing, and you talked about some things you might be able to do next time, and you had some summary advice here. And I know that you and I have talked about maybe some follow-up things that you would be interested in doing. So I think that would be great. You provided some great resources that people wanted to learn about this deeper. And again, I would just point people back to that URL to learn directly from Dirk on that webinar presentation and proceed that way. So I'm glad you were on today's call, Dirk, to talk about those things. I skipped over 2 presentations just in the interest of time, so I will include those during the next summary webinar and want to make sure that I cover those topics. So in the interest of time, what's going to happen next, the recording from this webinar is going to go on our website. You can find it at that link and the arrow at the bottom. You can go to previous webinars. Some things that are in the works, Katie Anderson talking about daily intentional practice. Some friends at Winona Health, not far from where I live, on some various topics. Dirk has mentioned some topics that he's interested in, as well as some experiments with innovation methods. Recent conversation with Dan Robertson, not Dan Robertso, but Dan Robertson, on understanding models and lean management systems. So some things going on there. Mentioned the folks at Winona Health. They host site visits. So if you want to go learn directly from them as far as what they're doing, you can learn directly there. If you happen to live in the Twin Cities area, on May 11th, doing a one-day workshop combining a number of these topics. This was rescheduled because of the weather, and I started my presentation with the view of the weather, but things are getting better. So May 11th, we're doing that one-day workshop hosted by Performance Excellence Network as well as Boston Scientific. So some upcoming webinars, May the 18th, Strategy Deployment Part 3, trying to tie some of these concepts together. Mark Graben is going to host a webinar with us, a book that he's currently writing. A lot of it is around the topic of understanding and managing variation. That'll be on June 22nd. A model framework that I've been learning about and thinking about and sharing with other people. People may be familiar with it, the Cynefin framework, sense-making framework, thinking about what kind of system are you dealing with and how do you approach different things given what system you're dealing with, is going to be a topic on July 20th. And just a wrap-up slide there. If you've got lessons or stories that you would like to share, feel free to reach out to me. Let me know a topic of interest, but also if you've got a story to share that you would like to share with others. It's a great way to learn and share with other folks. So I've got 1 minute left. I'll pause to see if there's any questions or people have any particular areas of interest that they would like to see featured on a future webinar. I'll give it one more pause today. Okay, well, I've got to go out and shovel some more snow. So you guys have a good day, and hope everyone has a good day and a good weekend, and looking forward to our next conversation together. Thanks a lot for your time today.
Thanks, Mike.